So I've taken a very unusual path in some ways. Currently, I work as a doctor in a big tech organization, Google, where myself and our team, we are working on the applications of artificial intelligence, AI, to healthcare, to try and make healthcare more efficient and accessible and high quality around the world. So my day-to-day involves kind of working with research partners mostly in the US and in India at the moment, where we try to analyze health data and develop new methods to, for example, predict patient outcomes or clean and structure and organize information in a way that makes it easier for clinicians to digest it. AI is part of what I do, but on the side of that and in parallel to that, we also work on systems that try and make it easier for clinicians to just visualize the health data that they have, and for patients to keep a record of their health data with them and carry it, along their health journeys. So it's sort of a combination of sort of basic digital health tools and then more future-facing sort of AI research of what we might be able to get towards. When I was in high school and starting university, I couldn't have imagined this as a career because it didn't really exist as a career. And so it, just like everyone says, it's sort of one thing led to another, but I'd always had an interest in sort of intersectional careers. I think that's where you can have a lot of creativity, where two fields butt up against one another. And, I was studying medicine and in the hospital, and one area that was really a glaring blind spot was around software and technology in the hospital, right? As a medical student and later as a junior doctor, the systems that we were using, many of them were still paper-based. The electronic systems that we did have kept, had some very obvious shortcomings. I remember this story of a patient who'd come down to Sydney from sort of the Central Coast, and he had forgotten his X-rays or his CTs from his previous hospital, and it ended up being easier for him to drive the 3 hours back up the coast, 3 hours there and 3 hours back, to kind of pick up a CD of his original images rather than to get them sort of transferred down to Sydney where we were. And that caused all sorts of other delays and had a domino effect on his care. And, such a simple thing that data doesn't flow easily and is fragmented got me frustrated and got me more and more interested in this world of digital health. I think there is a lot of hype around AI in every field, but especially in medicine. There are articles like, the AI doctor will see you now, and AI will replace doctors and things like that. And I think that that becomes a big challenge for the whole field, because it starts to obscure some of the real benefits of AI. And, the reality of it is that AI won't replace doctors. It'll be doctors plus AI will replace doctors who don't use it at all. AI can be a tool, just like an MRI, that can be interpreted and harnessed by the medical community, but doesn't need to, and can't really replace them. If anything, it should create more time and space for clinicians to, do what clinicians are best at, which is speak to the patient and empathize as fellow humans, with the patient sitting in front of you. And another that's gotten a lot of attention recently is this issue of bias in AI systems. This can often be really hard to detect, but if we train AI systems on historical health data that is riddled with all of these historical prejudices around, gender discrimination or ethnic discrimination or other things, then the AI systems invariably start to, repeat those same biases and recreate some of the problems that we're trying to help fix in healthcare. And so creating ways to analyze those biases and mitigate against them in AI systems is becoming really, really important. And actually, there are a lot of some of the top experts in this space are coming out of Australia at the moment. So we're learning a lot from academics back home.